Good evening, everyone, and welcome to a special New South Wales Family Daycare Association webinar in the PD in Your Pocket series. Today, we're going to talk all about COVID-19 in family daycare. My name is Elizabeth, and I'm your facilitator for this evening. Before we begin, we'd like to acknowledge the traditional owners of the country on which we meet today. I know we are on many different lands with many different traditional owners, but I'm currently presenting from the land of the Gadigal people, and I'd like to acknowledge them and recognise their continuing connection to land, waters, and culture. I'd like to pay my respect to the elders past, present, and emerging, and to all Indigenous people present today. So as you're aware, this is a special PD in your pocket about COVID and family daycare, paying particular attention to COVID in the Greater Sydney lockdown regions. However, some of the information will definitely be useful to family daycare educators in other areas. Please note, as this is a special PD in your pocket, there is no booklet and it may be a little bit shorter than our usual sessions. We will go through some information and then we're going to show a video interview with Dr. Jan Fizzell from the New South Wales Ministry of Health. We will then have time for questions at the end. Some of these questions may need to be questions on notice so we can make sure that we get absolutely accurate information for you. And there will also be further readings sent out to you as usual. If you have any questions about PD in your pocket, you can email info@nswfdc.org.au. So this session has been funded through the New South Wales Department of Education Sector Development Program. And we're providing this webinar and video in the hope that you can learn about keeping yourself and your families in care safe. We're going to concentrate on four main areas this evening. So the first one being Delta variant and lockdowns. We're also going to look at finances, gap fees, financial support. We'll have a look at how we can keep ourselves, the children and our families safe through methods like ventilation, outdoor play, QR codes, sign-ins, and also looking at how to find out those exposure sites. And lastly, keeping safe through vaccination. So first, let's have a look at the Delta variant and also lockdowns. So by now, you would have heard that the particular type of COVID-19 mostly circulating in Australia is this Delta variant. But what is it and why is it more of an issue? So the illness COVID-19 is caused by a virus, and viruses tend to mutate, to change as time goes on. This is why we have to get a new flu injection every year because the flu virus has changed. The virus that causes COVID-19 has changed as well. So we initially had the original strain and then the alpha version, and now we're up to Delta. So in case you were wondering where the names came from, COVID strains are named after the letters of the Greek alphabet. So they used to be named after the countries where they were first found in, but the World Health Organization, WHO, decided that it wasn't fair to those countries, so have renamed them to the letters of the Greek alphabet. The Delta variant is the nastiest strain to date, and it's about 60% more infectious than the Alpha variant. And that was already 50% more infectious than the original one. It can enter our cells more easily, and this is why it's more transmissible. It is because this variant is so infectious that Greater Sydney has gone into lockdown. It has different symptoms than the original version, and people tend to have headaches and sore throats with the Delta variant rather than coughs. The most important thing to know about the Delta variant is that it's a lot easier to catch and it's a lot easier to pass on. And so this is where lockdowns come into play. As you are aware, the Greater Sydney area is in lockdown. Family daycares can continue despite the lockdowns, just like all other childcare services, although families in Fairfield, Liverpool, Canterbury Bankstown, Blacktown, Parramatta, Georges River, and Campbelltown have been strongly encouraged to keep their children at home if they can. Educators should discuss with their families their individual circumstances and care requirements with this in mind. The reason why we're in lockdown is because the Delta variant is so transmissible. The aim is to have as little contact with people outside of our households to reduce the risk of catching this virus. So let's now take a look at how this affects us financially as educators. Where families have decided not to send their children to family daycare, educators will lose income. So let's have a look at the financial impacts. The federal government has decided that educators can waive gap fees for children enrolled but not attending. This, of course, means that you'll only receive the childcare subsidy part of these fees. For most educators, that will mean that they will get the part of the subsidy they usually get from the service, but they won't be able to get the part that they get from families. Unlike last lockdown, there will be no additional childcare relief payments to services from the Commonwealth Government. And it was announced only just today by the federal government that once a lockdown has gone past 7 days, all families will be able to access additional days of allowable absences if their children are not in care. So this will be backdated to the beginning of the lockdown. So essential families in Sydney will get at least 9 weeks of additional absences, and they won't have to draw on their usual 42 allowable absences. In regards to financial support, so there are financial support measures that we can use. The three that are most relevant to family daycare educators are, first, we have the COVID-19 business grant. So educators may be able to apply for a grant if your turnover is over $75,000 per year. So it's possible that not too many educators will be in this category. But the level of the grant depends on your turnover loss. So if you've lost 7,500 for a decline, your grant will be 7,500 for a decline of 30% or more. If the decline is 50% or more, you'll get 10,500. And 15,000 for a decline of 70% or more. So you just need to look into what your turnover loss is, and that really depends, and that will determine that percentage that you get. The second financial support measure that family daycare educators can call on is the micro business grant. And we think that more educators will be eligible for this one. So this is for educators with an annual turnover of more than 30,000 and under 75,000. So you may be able to apply for a $1,500 payment per fortnight, and this will be back paid to when the drop of income started. This is designed for businesses that provide the primary income source for a person associated with the business, like an educator, and when their income has dropped by at least 30% compared to a similar period in June or July from 2019, so prior to the pandemic. You apply for these two payments online through Services New South Wales. The third type of financial assistance is from Centrelink, and this is called COVID-19 disaster payment. It will especially help educators earning less than $30,000. So if you lost less than 20 hours work per week, you'll get around $325 to $450 each fortnight if you're eligible. If you lost 20 hours or more of work per week, you'll get $500 to $750 each fortnight if you're eligible. And you apply for this one online through Centrelink. So there's some different financial relief that you can call on, depending on what your business makes. So let's now have a look at keeping safe. Now, to understand how we can keep safe, we need to understand how COVID-19 is transmitted and what should we do to keep ourselves safe as educators. Last year, when people first started getting COVID, scientists thought that it was mostly passed on via respiratory droplets, by someone coughing or sneezing, and the droplets landing on objects such as furniture or door handles. So we were all taught to wash our hands and clean everything as well, and not to touch our faces so we didn't pick up on those droplets. Then the scientists realized that the virus that caused COVID was actually passed on via aerosol transmission. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These small liquid particles land on objects like furniture, but they also hang around in the air. The importance of this is that we now know that the main way the virus is spread is by people being close to each other. When the aerosols are inhaled or come directly into contact with the eyes, nose, or mouth, the smallest, most fine particles and aerosol particles formed when these fine droplets rapidly dry are small enough so that they can remain suspended in the air for minutes to hours. And that's why we're seeing this great deal of transmission. So because of this, the very best way for to both stay safe and to make sure that you don't infect anybody is to wear a mask. The next most important thing is to make sure that the area you are in when inside is adequately ventilated. Even better to spend as much time as possible outside. So ventilation is the deliberate introduction of fresh air and removal of stale air from a space. So getting rid of all those suspended particles. Open or well-ventilated spaces reduce the risk of transmission of COVID-19 because infectious particles are more quickly dispersed in the open air than in spaces with less ventilation. In most cases, outdoor settings have better natural airflow than indoor areas. So where possible, when there is COVID circulating in the community, it makes sense to spend as much time outdoors as possible and have windows and doors opened at all times. In regards to mask wearing, so because of how infectious the Delta variant is, and because of the current outbreak in the Greater Sydney area, all family daycare educators have to wear a mask at all times they are providing family daycare, indoors or outdoors. Nobody likes wearing a mask, and it's hard for everyone, especially those wearing glasses. We know it's hard for children to have everyone around them wearing masks as well, especially for infants and babies. It can be quite intimidating. So we understand that the challenges that mask wearing brings, but it's the best way to keep our children as well as ourselves safe. And for people in Greater Sydney, it is now mandatory. Another thing we can do is QR codes. So all family daycare services now have to have QR codes. If a family, staff member, or visitor has interacted with your service while you are providing education and care, no matter how minor the interaction may be, they should check in using the Service New South Wales QR code. You have to display the code at all times you are providing family daycare. Your service should help you get your QR code if you haven't already done so. Families who do not enter the residence of the educator do not need to check in, but just keep in mind that residence includes any front gardens, verandas, so any way they're coming onto your property, you need to be signing in with the QR code. While educators are not responsible for ensuring families do check in, they must take reasonable steps to ensure people entering the premises check in using the code. So that might mean having more than one code available in different locations close to the entrance You can ask to cite it, although that's not necessary. Under the regulations, Regulation 159, it requires that family daycare educators must keep a record of attendance signed by the person who delivers the child, or if their signature can't reasonably be attained, then the family daycare educator can sign on that person's behalf. Now, New South Wales Family Daycare Association believes that the current COVID-19 emergency in Greater Sydney would be considered a reasonable reason for educators to sign in children rather than the families. And this is really going to reduce the spread of infection as you don't have families touching pens or iPads, and it ensures pick up and drop off is as quick and smooth as possible. You don't have people gathering at the entrance or exit. Okay, so we'll have a quick look at exposure sites as well. So I wonder, do you regularly check the list of exposure sites in your area? These are places that someone who has COVID has been while they were infected before they have been diagnosed. So the website you need to look at is listed on the slide there, or you can Google Transmission Venues New South Wales. You should check these lists regularly so you can see if you are considered to be a contact of someone who has COVID and needs to have a COVID test. So you can look at it at a map view or a list view, and you can simply enter your postcode and it will tell you all close by exposure sites near you. Something else that's really important that we need to discuss is mental health and well-being. So, one of the important ways to keep yourself safe as an educator, especially during lockdown periods, is by looking after your mental health and well-being. BU, Beyond Blue, and Early Childhood Australia Mental Health Program for educators suggests making time to look after yourself so you're in a better position to support those around you. Children and young people's emotions can be affected by how adults feel. And we know children are very instinctive in understanding moods and how we're feeling as adults. They suggest you try and maintain your routines, know your limits, debrief with trusted colleagues, families, or friends, so whoever your support network is, and try to do things you enjoy to manage your stress levels. It's also important to know that there are free services to support you. On screen, we have the number of the New South Wales Mental Health Line, so that's 1800 011 511, which operates 24/7, and it can connect you to mental health services if you're concerned about your mental well-being of you or someone else. You can also go to the BU website at www.bu.edu.au. And make sure you're being really proactive about looking after yourself. Try not to leave it to a point where you get really concerned. There's no shame in reaching out for help during these exceptionally hard times. BU also points out that children may experience more disruption than usual during the outbreak. They say that routine and rituals are important to maintain at this time, and the little things like singing familiar songs or having a joke, reading favourite stories can really create an emotional connection and relieve anxiety. So try and keep things as normal as possible for the children. BU also suggests that educators talk about what's happening in the news and help children regulate their emotions and provide additional support to children. Support children who are showing signs of stress and anxiety. Sometimes we forget how much they actually pick up on. They're going to hear things maybe on the radio, on the TV that aren't familiar, and they might want some clarity or reassurance. So make sure you're available to provide that. And if they do ask questions, be there to answer them in an age appropriate way. And the last thing I want to discuss tonight is vaccinations. So, COVID-19 can spread quickly and widely. It has resulted in the death of over 1.9 million people worldwide and over 900 deaths in Australia. So, let's now have a look at the importance of vaccination. When enough people in the community are vaccinated, it slows down the spread of disease. Achieving herd immunity is a long term goal. It usually requires a large amount or the majority of the population to be vaccinated. Studies will monitor the impact of COVID-19 vaccines in Australia and whether herd immunity is developing over time. So, how do vaccinations work? All immunisation works the same way. The vaccination uses your body's immune system to increase protection to an infection before you come into contact with that infection. In other words, it's like being infected with the disease without suffering any actual symptoms or very minimal. If you come into contact with an infection after you've been vaccinated, your body works to stop you from getting the disease. Or you may just have a really mild case. Vaccines have been rigorously tested to demonstrate their safety and effectiveness in promoting against infectious disease. To slow down the spread of disease in Australia and the world, we all need to get vaccinated. So, what does this mean for family daycare educators? Everyone over 18 years in New South Wales can get a COVID vaccination, and all educators are eligible to get vaccinated now. If you're 60 years and over and have not been vaccinated, you should book a COVID-19 vaccination appointment with your doctor GP immediately. If you are aged 40 to 59 and have not yet been vaccinated and are able to obtain an appointment for the Pfizer COVID-19 vaccine, please discuss your circumstances with your GP. You may be able to get the AstraZeneca COVID-19 vaccination based on your risk and the likely benefits for you. So what they do is a risk analysis and they take into consideration all the different factors and look at the best option for you personally. New South Wales Health vaccination clinics are also available to provide the AstraZeneca COVID-19 vaccine to people aged over 40. Any educators under 39 wishing to get AstraZeneca COVID-19 vaccine are encouraged to talk to their GP. So because the Delta variant of COVID-19 is more transmissible overall, the New South Wales Health Department expects it to be more transmissible amongst children. And as educators, that's something we need to be mindful of. The Australian Technical Advisory Group on Immunisation, ATAGI, suggests that people living in Greater Sydney who have received their first dose of AstraZeneca vaccine should bring forward their second dose to between 4 and 8 weeks after their last dose. So bringing it forward so you've had your 2 doses earlier. They have also advised that adults younger than 60 who do not have immediate access to the Pfizer vaccine should reassess the benefits to them and their contacts from being vaccinated with AstraZeneca versus the rare risk of the serious side effects. In other words, if you cannot get a Pfizer vaccine, talk to your doctor about whether you should get an AstraZeneca vaccine if you are in Greater Sydney, because the risks of the virus may outweigh the risks of those very unlikely side effects. Now, speaking of this, I want to go through some vaccine myths as well to clarify some information. There are many myths about vaccination circulating, especially in places like Facebook and other social media. It's important to get accurate information from your doctor, a professional, or from the Department of Health. So I'll go through some of those common myths now. The first myth we see a lot is that vaccines have not been fully tested. So before a vaccine is able to be used in Australia, it must show that it has been tested extensively during development and then in thousands of people. Testing first begins with laboratory research, then animal studies, and then finally human clinical trials. Clinical trials involve testing the vaccine in volunteers and are conducted in phases. Clinical trials must provide scientific evidence which demonstrates that the benefits of a vaccine greatly outweigh any risk. Before a COVID-19 vaccination is approved for use in Australia, it must pass the Therapeutic Goods Administration assessment and approval process. This includes assessment of its safety, quality, and effectiveness. All the COVID vaccines have been judged to be safe. The second myth we see is there is a high chance of blood clots from AstraZeneca. So there has been a link established between the AstraZeneca vaccine and a very rare but serious side effect which causes blood clots. There is a very, very low chance of this side effect, which may occur in around 4 to 6 people in every million after being vaccinated. Another myth that we hear is it should be everyone's own choice to get vaccinated. And it is. Vaccination is not mandatory for the majority of Australians. But eventually, families or your service could insist you to get tested. Unfortunately, people's individual choices do matter to everyone when you are talking about vaccine preventable disease. When a large portion of a community, so the herd, becomes immune to a disease, it makes the spread of disease from person to person unlikely. As a result, the whole community becomes protected, not just those who are immune. And this is really important because there are many people who can't get immunized, like those who have certain diseases or those who are very young. So by getting vaccinated, we're not just protecting ourselves, but we're also protecting people in those categories. So the only chance of being protected is for everyone else to get the vaccine. Another myth we hear is that you can still catch COVID and die if you get the vaccine. So in the United Kingdom, 83% of cases of Delta are in people who aren't vaccinated. The latest numbers show that after the second dose of vaccine, AstraZeneca or Pfizer, you have a 96 to 92% protection from serious illness and hospitalization. You can still catch COVID if you are vaccinated and you can still pass it on, but the key is that you are unlikely to have serious illness and very unlikely to die. And the last myth that we see is there is no point in having it now. A lot of people are discussing or contemplating postponing it. So vaccination is the best way of protecting yourself and others around you. Waiting until you want to go overseas or some other time is not doing the best thing for you. It's not the best thing for your family or the children and families that you provide care for. Also, the sooner we all become vaccinated, the sooner we can live without lockdowns. So that brings us to the end of the presentation. I hope you found all that information really beneficial. We're now going to move on to the video. So the video I'm about to show you goes for about 20 minutes, and it's an interview with Dr. Jan Fizzell from the New South Wales Ministry of Health. She's being interviewed, as usual, by education and care sector journalist Lisa Bryant. This video is on the PD in Your Pocket webpage if you want to view it later. So I'll play the video for you now, and then we will have time for questions afterwards.
Hello and welcome to this special issue of PD on a Pocket. I wish we didn't have to do this one because it's about COVID-19 again, but here we are. And I'm really pleased to have someone from the Ministry of Health with us today. Jan Fizzell is the Senior Medical Advisor from the Ministry of Health. Welcome, Jan.
Good morning, Lisa.
So look, can you tell us, like, basically, what's the best way for educators to keep themselves safe at the moment, especially those educators that work in the lockdown areas? You know, we've got quite a few in Greater Sydney, and of course, quite a few in the Liverpool, Canterbury, Fairfield area.
Look, the first thing that we can do is just be really aware of our environment and who's in it and how they're in it. So the first thing is being aware of, are there any warnings for my particular area? So have people been asked to stay at home or have extra testing? And are there any places that I go where I could potentially interact with other people? So I know for many people, work is the major place where we interact with other people. And if you're an early childhood educator, the chances of working from home or having your work come to you at home is really important, because
except remember, we're dealing with family daycare educators. They get to work from home the whole time.
Absolutely. So your work comes to you at home.
Yeah.
And so I think that's the really important thing, is having a really good rapport with the carers and parents of the kids who you're looking after, working with them each day to build that trust, to make sure that they know that your expectations are that they'll keep their kids at home and not bring them to you if they're unwell. That if they've been asked to isolate and their family's been asked to isolate, that they will let you know and make sure that they don't bring their children if they've been asked to isolate. So isolate is what happens when people who have been exposed to the virus are found by contact tracers, and we say to you, you're at higher risk of having the virus. Please, you must not leave your home, and you must get tested, and you must stay home for 14 days. So we ask some people to isolate, and that's different to the stay-at-home orders, because if you're in a stay-at-home area, basically people are still allowed to leave home for essential work, or you're allowed to provide childcare in your home. So it's really important that people have that opportunity to think really carefully about bringing their kids to your place. I think the other thing is just while you're out and about in the community, really limiting your time out and about as far as possible. When people are dropping off the kids, I guess it will depend very much, but try really hard. I know it's hard to not have a really good conversation with parents, especially if you're in the intimate setting of family daycare, but try and do that conversation about their child's day, what they've done, all those sorts of things, perhaps through a phone call at the end of the day, or however you'd normally spend that chunk of time with the pick up or drop off. Try and do it as far distant as possible. So maybe bring the child into the home and then have a chat with the parent on the phone, and parents in the driveway, and you're in your house.
Okay, that makes sense. What about vaccine hesitancy? I think there's a fair bit of it in family daycare. What can you tell us to make family daycare educators feel comfortable and, in fact, even eager to go out and get vaccinated? I know I was eager. I can't wait to get my second one.
Look, I think one of the key things is people are saying they're concerned that we've got these vaccines so quickly, and we haven't got these vaccines so quickly. The vaccines have come on years and years and years of research, which has then been channeled through a major international effort into having safe and appropriate vaccines against COVID-19. The other thing that we're doing is we're actually immunizing millions of people with the same vaccines around the world all at once. So some of the information that may have taken us 5 or 10 years to collect about rare side effects, we're finding it out really, really fast. And perhaps in our complete and utter desire to be open and transparent about everything to do with the vaccine, some of the risks may have been overemphasized compared to the huge benefits. So the first thing is to say that both vaccines help prevent you becoming sick. They help prevent you going into hospital. They're very good at preventing you going into intensive care in hospital, remembering that we've had in this current outbreak even people under the age of 20 with no significant medical conditions in intensive care. You know, they've been that close to dying because of the severe nature of this illness. We've had people who have unfortunately passed away. And it's, again, this is a very severe illness in any age group. And so it's really important, no matter your age, to get vaccinated. The older you are, the higher the risk is that you will wind up in intensive care or hospital, or that you may have some lifelong problems after having COVID-19. It's not a mild illness for many people. For some people, it will only be just like a bit of a cold. You'll have a bit of a runny nose, a bit of a headache, and feel off. But while you're having that bit of a headache and a runny nose, you can infect your entire family. You can infect any of the work colleagues you go to, and you can also infect the kids you're looking after. So it's really, really important to not ignore any of the symptoms and to get tested. The really important thing about the vaccines, though, are they are free, they're available, and many, many early childhood educators are currently eligible to be vaccinated. The key things are, if you are over 40, no matter what your circumstances, you're eligible to be vaccinated, and you can book in at a GP or at one of the New South Wales vaccination hubs or one of the Commonwealth vaccination hubs. If you're under 40, if you're providing care on a regular basis to somebody with a disability, if you have an older person that you provide care for on a regular basis, if any of the children that you care for have significant disabilities or significant medical conditions, or if you yourself have other medical conditions or a significant disability, you're currently eligible to be vaccinated with either vaccine. If you're under 40 and you haven't got any of those special considerations, the AstraZeneca vaccine is available to you. The key thing is to have a chat to your GP about the risks and benefits to you personally, and then your GP will be able to advise whether you should be vaccinated with that vaccine or not. It's a good vaccine. If it was the only vaccine we had available, we would all be rolling up our sleeves and thanking the heavens for that particular vaccine. And so it's really important for people to not think that it's a second-class vaccine. It is a great vaccine. It provides really good protection after you, particularly after you get that second dose. And so it's worth considering if you find that in your local area it's hard to access the Pfizer, or if you're not currently eligible for the choice if you're under 40.
But blood clots.
Oh, I know. And look, I think we should put this risk into the wide range of risks of us as humans and what we're willing to do. Most of us are happy to fly to Europe if possible. I think that's true. If you go on a long haul flight, you have a 1 in 6,000 risk of developing a clot in your leg that can travel to your lungs and cause major, major problems, including death. If, however, you have the AstraZeneca vaccine, even if you're quite young, you've got about a 1 in 100,000 risk of getting a very severe blood clot. So, we're talking about significant differences in risk here. And most of us, when I'm traveling long haul, getting a blood clot in my leg is not the thing closest to my mind.
I don't even wear those support hose. I'm going to wear them immediately. I had no idea it was so high.
It is so high. But again, it's one of those things that because it's not immediate, it's not a choice we're making, am I going to get a blood clot or not? We feel like we've got control of that particular thing. With the AstraZeneca vaccine, what people don't realize is that means that out of that 100,000 people, 99,999 have no problems whatsoever. But if we look at COVID causes clots too. And so particularly once you are over 30, your risks of getting a clot from COVID when you're in a high prevalence area is much, much higher, and really nasty clots too with COVID. COVID is not nice. It's a really nasty disease. Then you've got a much greater chance of actually getting a clot from COVID than you actually have from getting it from the AstraZeneca vaccine. Plus, COVID can do all sorts of other nasty things to you, and the AstraZeneca vaccine can prevent those nasty things from happening. So I'd put my money on the AstraZeneca, to be perfectly honest.
Yeah, I know that some of our educators come from countries that are really struggling to get any vaccines. And I'm sure if we turned to them and said, oh no, I think I'll wait for the Pfizer because the AstraZeneca isn't quite so good, they'd be really horrified because, if it's a choice of life or death, which it is for much of the world, you get what vaccine is available to you.
And I think that's it. Members of my family have had both vaccines, and people in my family are now protected. So even though this is a really difficult and worrying time for so many of us, I do have some peace of mind that our risks of taking up an ICU bed or my risk of attending their funeral, to be perfectly frank, is much, much less. So I think that's why.
But we are hearing about some people that have been vaccinated being in ICU or being hospitalised? What's that about?
So when we say that people who are fully vaccinated are at reduced risk, it does mean that if I've vaccinated 1,000 people, I think it is, one of those people may still be susceptible to going into ICU. So enough people who are fully vaccinated, we may get some people who do wind up in ICU, but the people who are in ICU or they're often partially vaccinated. So they've had that first dose and then they haven't sealed the deal with the second dose. Sealing the deal with the second dose is super important. And we've actually suggested with the AstraZeneca in New South Wales at the moment, if you've had the first dose, bring forward that second dose by a month so that you get that second dose into you that much faster. You'll still have really good protection, perhaps not as fantastic super duper as at 12 weeks, but you'll get some good protection from that vaccine. It's also really important that people understand that vaccines limit the severity of the illness. So I'll give you an example of my son. He was born at a time when chickenpox vaccine wasn't widely available. I did get him vaccinated against chickenpox. They had an epidemic of chickenpox in his year 1 class. He had one spot and a bit of a runny nose, whereas there are other kids with that whole miserable illness of mouths full of sores and arms and legs full of sores. So whilst he did have a breakthrough illness, for him it was a minor inconvenience, whereas for other children it was a lot of suffering. So we may see the same sort of thing with COVID, where you may get a minor illness, but that minor illness is nowhere near as severe as winding up in hospital or ICU.
Yeah, that's true. Okay, so let's move away from vaccination to ventilation.
Yep.
How important is ventilation as a way of stopping COVID?
As I sit in my obviously closed up lounge room by myself, it is really a really important thing. COVID likes being indoors. It likes us when we're close together. The new Delta strain is a bit more ferocious, and so it will transfer even between people wearing masks. But when you wear that mask, it means that if you're infectious, the chances that you're spitting virus out into the world are greatly reduced. And if you're wearing a mask, the chances that you will receive that spit virus is much, much less. But outdoors, it means that there's much, much more room for that spit out virus to go around. So the chances of infecting somebody else outdoors greatly decreases. So where you can, and I agree, Sydney is very cold today, and it may be cold wherever you are, it might be beautiful weather, but where you can do things outdoors, outdoors is the place to be.
Okay. When should educators have a COVID test? I've been lucky enough not to need one because I've never had any symptoms. One night I was a bit, maybe I'll think about it, and by morning I was fine. So I've never had to have one. But when should educators make that decision that, yes, they should go and have a COVID test?
So the first time you should have it is if you have any of those symptoms. So this is not a sore or scratchy throat. This is me talking too much today. But if you had a sore or scratchy throat, a runny nose, feeling hot, cold, bit of a headache, just feeling generally run down and out of sorts. I know many of it, for us, that's, nearly every day at the end of the day, but abnormally so. That's a good time to get a COVID test because the symptoms of COVID can be very, very mild to start with. The next time you should have a COVID test is if New South Wales Health asks you to. So sometimes you will have been to a certain venue where somebody with COVID has been, or you will be in a house where somebody in your household's brought it home. We'll ask you to get tested on a regular basis. The contact tracers will tell you how often, and you should get a test in those circumstances. The other time at the moment is when we have a local government area where there's a lot of infection going on, and you have to leave your local government area to go and work. Those people are being asked to test on a regular basis. At the moment, it's 3 days for people in certain local government areas.
That's not educators because they're all working from
at home, of course. But somebody from their family may need to leave.
Yep.
Yeah. And so if somebody from their family needs to leave, it's important their family members, their household members, keeping up with that surveillance testing. So the early childhood educators working from home, not a problem. But if they've got a family member who's leaving, it's really important that they continue to encourage that family member or household member to do that.
Okay, and masks. I think every educator was a bit shocked that the department's now decided that educators need to wear masks. Why should they wear masks when they're working with children, apart from the fact that it's now the law?
Look, the thing that we've learned about Delta is previously kids were really bad at giving COVID to other people. They, unlike flu and gastro and all the other bugs that kids, share with us so generously, the COVID was not one of those ones that kids shared generously. Delta strain has changed that for us, unfortunately, and we now are seeing child-to-child transmission and child-to-adult transmission. Previously, in most sectors, we were mostly worried about adult-to-adult transmission. Now, with the kids, we're seeing child-to-child and adult-to-child and child-to-adult transmission. So wearing a mask will help if you're infected from infecting the kids, and may give you some protection from the kids if they're going to infect you. So even if you're in your own house, and I know how easy it is to wind up with a chin diaper or an earring, try and keep it on. Try and get the kids used to you wearing it, because I know for some kids, but a lot of kids are really used to it now. I saw a couple of kids and now they're starting to point out, that one's not wearing a mask, Mum. And so it's becoming a bit of a social norm for adults to be wearing masks in so many situations now. This will just be another situation where the adults are wearing masks.
You talked about the Delta strain. We've learned, people have learned a little bit about it in the webinar that we've just held, but how much more infectious is the Delta strain than previous strains of COVID?
So what we're seeing in international experience is a person with Delta strain can manufacture about 1,000 times more viral particles than a person infected with our old-fashioned COVID, if you like. And so that means that you've increased the ability to give the Delta strain to other people by about 50%. So previously people used to infect about 2 people. Now we're seeing them infect 4 to 5 people. But the other thing that they're doing is they're doing it really fast. So time from exposure to being able to infect someone else used to generally be about 72 hours and more generally 5 days. So you used to have quite a bit of time between being exposed and actually infecting other people. What we're seeing now, though, is somebody is exposed, becomes infected, starts making their own little virus factory, makes the particles, and they're able to infect somebody else within 24 to 48 hours. So it moves really, really fast. That's the other thing. And that's a lot to do with how much virus we make. Delta seems to be very good at teaching our body to make more virus, because that's how viruses work. They use our bodies to make more viruses to spread more viruses. And Delta is really good, one, at infecting you. 2, because it makes so many viruses, it means that the next person's more likely to be infected, and that more likely to be infected next person makes viruses even more quickly. So it spreads really, really fast. And that's where the mask helps, because it means that despite Delta's desire to get out of you and spread everywhere, that mask helps catch most of it. It doesn't catch all of it, but it will help catch most of it and reduce the risk of infecting someone else. And similarly, wearing that mask means that if you're walking past a human virus factory, you've got less chance of breathing in their virus.
It doesn't sound like something I want to ever come in contact with. Could you just answer one other question, which I know people are sometimes puzzled about? Masks, are there better sorts of masks than other masks? How often do we need to change our mask? What's masking protocol? And which way does the colour go on those disposable ones?
Sure. So the best mask is the one that you're wearing. So if you have no mask and there is a mask, any mask is better than none. That's the first thing to say. The surgical masks or the medical masks that have got the color on the outside and a white on the inside, they've got a fluid repellent layer. And I also find that they're quite good for me because I'm wearing glasses and I can actually mold them around my nose so that I'm not getting the constant condensation up behind my glasses all the time. So I tend to use the disposable surgical masks. They've often also got really nice soft elastic, which doesn't cut into my ears quite as much. If you want to use a reusable mask though, try and get one that's got 3 layers of fabric, with the outer being a bit of a fluid repellent material. That could be an old tent, that could be one of those green shopping bags, although I will tell you those green shopping bags are very hard to sew through, with a couple of cotton layers on the inside like t-shirt material just to absorb things. And generally speaking, with the mask use, they usually will last with you talking and being active for about 4 hours before you need to change them. But do try, and I'm not always good, but do try and remember to do your hand hygiene before you handle your mask and after you've handled your mask. And that simply just stops you, if you are happening to be that virus factory, from, you know, putting virus down around you and where you're doing things with your mask. But not always possible, and certainly more difficult when you've got to talk to people or yell to people or do anything else where your voice isn't clear. So hard, it is hard, but also at the same time, I remember having to stand for 5 hours in an operating theatre with my elbows deep in somebody's guts for 5 hours with a mask on straight. So talking with a mask on doesn't seem that hard compared.
Definitely not. Okay, is there anything else you want to say to educators? Thank you for all your advice.
Look, early childhood educators are an absolute cornerstone in people's development, and you are so important. And so you also have a lot of power to educate and to spread good messages to people. So please keep doing what you've been doing for many, many years. Help the kids understand what's going on, help them if they're frightened, reassure them that, yes, this is different, but we will get through this. Talk to them about why you're wearing a mask. You've got the same words as I've just given you. You can use those words too. It really is just about catching spit and stopping breathing in somebody else's spit. And do please, just as you would like the kids who are coming to you to be immunized against nasty diseases like rubella and measles and so on, please take the opportunity when it's offered to you to get vaccinated. I know it's not easy at the moment, but please keep trying. Those vaccines are out there and more are coming. So please roll up your sleeve, protect yourself, protect your family, and protect the people you're caring for. It'd be really, but just stay safe, keep doing a great job, and thanks for listening to me.
Thank you very much, Jane.
We do have Lisa with us, Lisa Bryant. She's going to help us answer some questions that have come through. Lots of questions coming through, so we will try and get to some of them, but we'll also post answers to them on the Facebook page as well in the coming days. So first, to start us off, a question came through just wanting to clarify about the absent days. So families are going to get at least an extra 9 weeks additional absent days where they don't have to go into their usual 42 allowable absences. So that's going to support a lot of families, and that's just for children who aren't attending. So I hope that clarifies that question. Another great question that came through was about how can we keep our distance from parents when they're dropping off or picking up children under 1. And of course, you know, we have to use, we have to do as much as we can, but we also have to be practical. So I understand, especially exchanging infants, we do have to get quite close to parents, but there are some things that we can do to try and mitigate those risks. Those being wearing masks, of course, getting families to sanitize before drop off. So if you do have a front entrance, you could have the hand sanitation station at the entrance so that they're sanitizing before handing over. Both requesting that families wear masks at drop off, and of course yourself as the educator. Signing in for parents is another big thing that can mitigate any transmission so that they're not handling anything in the service. So think about whether you can sign in for parents and really minimize that handover as much as possible. But of course, we completely understand we also need to factor in the well-being and the emotions of the child and the parent, and drop-offs with infants can sometimes be a bit emotional, especially if they're new at the centre. So see what else you can do to mitigate those risks, like the masks and the sanitizing and taking away the sign-in process. And then, you know, doing the best you can to be aware of the emotional needs of the child and the parent. Lots of financial questions coming through. So the best advice is to have a conversation with where that financial support comes from. So that could either be Centrelink or Service New South Wales. You could also have a discussion with your service provider. There was one that we
Can
might.
I just add to that about
Yeah,
the
absolutely.
finances? Because I've seen the sorts of questions that people are asking, and I'll just try and kind of summarize it a bit for you.
Yeah,
Now,
absolutely.
as Elizabeth said, yeah, please, if you've got an accountant, ask them. The other way to get the information is just to go on the Service New South Wales website, and it's got it quite clearly there. But I just wanted to talk about where the different payments are coming from and just go over that again, because I'm seeing the questions are asking that. So there's the disaster relief payment that comes from Centrelink, and everyone said, but like I've got one child that's still coming on one day and 3 children on another day. What happens? That one's just really clear because it's meant to be for workers that are employed. So it's about hours. If you've lost your hours totally, if you've lost half of your work or all of your work, then you can claim that one. I really don't think many family daycare educators would be eligible for that, and it would be more likely to be the ones who are eligible are the ones that are employed. So what we're looking at more is the two from Service New South Wales. The one that's caught for micro businesses, their businesses earning over 30,000 or under 70,000, and the ones for businesses that are over 70,000. If anyone's in that over 70,000, you really should have an accountant, so I'm not going to talk so much about that one. But the 30 to 70,000 one, people are asking questions like, if I didn't have my business in 2019, am I still eligible? Yes, you are. You've just got to provide different sorts of information. Someone said they'd applied and they hadn't heard back on it. I applied too and I didn't hear, but bingo, suddenly there was money in my bank account that hadn't been there before. So you may not get an email or something, and it took a little bit over a week for me to hear. So, or for me to get that money in the account. I still haven't had an email from them, so check your bank account. People are saying, okay, what if I didn't lose 30%? What if I've only lost 20%? And unfortunately, there is no money to compensate you if you haven't lost more than 30% of your income. But you're in a pretty kind of lucky position because a lot of people have lost a lot more income than that. So I know that losing any of your income when you're on small wages, like family daycare educators are, is hard. But it's the money that's there is really for those that have lost a larger proportion of your income. People have asked about which 2 weeks is it? Is it July or August? It's any of the 2 weeks of lockdown compared to those two weeks in 2019. People have said, how do I apply? Go to the Service New South Wales website, read all the stuff that they need you to have, gather that information together. Some of them require a letter from from an accountant, others don't, and then apply. And if you get stuck, abandon the application, go and get the other bits and pieces you need, and then apply. I think we might see if New South Wales Family Daycare can put out a bit more information on this, because I can see that people are getting confused, and there's a lot of misinformation about the money going out. So I'll see if we can summarise it and get it out to people. But go to that Service New South Wales website, because all of your questions can be answered. Every question that someone's asked, the answer is there. People have said, do we get any compensation if we're waiving fees? No, you don't, not from the federal government. It's not like last time, but you can get more, if because you've waived fees, you've lost that 30% or more of your income, then you can get one of the 2 grants. Yeah. I think that covers most of the questions about money, but I did notice quite a few questions about absences. So I just want to also expand on what you said there, Elizabeth, in that you don't have to apply for the additional absences. It'll just be granted to anyone in the lockdown areas. And the other question I wanted to answer is people are saying, is the masks just in all in New South Wales or just in the lockdown areas? It's just in the Greater Sydney region. So if you're outside of that, you don't need to wear masks when you're as an educator. Okay, back to you, Elizabeth.
Great. Thank you so much, Lisa. Thanks for all that clarity. That's fantastic. I think you've answered all of my questions that I had noted. There was just one other one that I thought was a good question. Is with the essential worker or parents who are considered essential workers, do they need to provide their negative COVID test every third day to the family daycare? As far as I know, they don't.
No,
do you
they
know
don't.
anything about different
LGAs? No,
or...
they definitely don't.
Yeah.
So we don't need to check on that.
Yeah. So childcare in all forms is an open service currently, and we don't need to be monitoring those third day reports. So, but it's a really good question. But that brings us to the end of our session. So I'd like to firstly thank you so much, Lisa, for your help this evening and providing that information. And thank you everyone for your questions. I want to remind you, you can also participate in the Facebook group. So if you haven't already joined, you can open Facebook and type in PD in your pocket. And it's a great place for you to discuss the topic and also what you're doing in relation to it as an educator. It's a great networking space for family daycare educators, either on tonight's topic or any of the previous ones that we've discussed. We will be sending you some further readings, and as Lisa said, we'll try and put together a bit of a fact sheet about those payments for clarity. So look out for these in your email. Otherwise, thank you everyone so much for participating this evening. I hope you've gained a lot, and we look forward to seeing you at our next session. Thanks, everybody.
Thank you.